You're watching NBC4, the Tri-State News Channel. And now, Sue Simmons, Jim Rosenfield, Janice Huff, and Len Berman. This is News Channel 4, live at 5.
Also had new laser treatment for varicose veins.
Later, a new laser treatment for those unsightly and painful leg veins, varicose veins.
Well, if you suffer from varicose veins, you probably know that you can have them injected or lasered, depending on their size and location. But most big varicose veins come from the failure of a large vein in the groin, one that had to be surgically stripped out until now. Showing off her legs is not something Doreen Allison normally does. It's the varicose veins she's developed that make her self-conscious.
My mother had them, my grandmother had them, and I have had surgery done twice before, which didn't really work very well.
Fabienne Lecole also had varicose veins and began with her second pregnancy and got worse after her third. Like Doreen's, they were painful.
By the end of the day, my legs were swollen and this vein was really, really hurting. It's going to be about 4 years that I haven't been wearing a skirt or a dress.
These veins are arising because of a failure of the main vein.
Even though the most obvious veins are around the calf, ultrasound shows that the real problem is higher up, near the groin, where the main saphenous vein has an important valve that fails in many patients.
The valves do not work properly, so the blood can flow towards the heart as it should, but then it flows backward towards the feet, which it should not. The pressure distends the walls of the vein. That creates more valve failures, and then you see these ropey veins that protrude from the skin.
Normally, treating the large saphenous vein means surgical stripping of the vein, but now there's a laser for the job. Not the kind you've heard of before that shoots through the skin. This vein is too big and deep for that. This laser actually goes inside the vein. You can see the light glowing through the skin.
The laser energy is being absorbed by the wall of the vein, so that basically we will weld it shut.
Dr. Navarro has published a study of the Endolaser saying the 2-year success rate is 97%, with no skin burns or other complications. Now, plus, the Endolaser treatment can be done in the office under local anesthesia with the patient fully awake. Now, that avoids the added expense and risk of surgery in the hospital. Not to mention that there's virtually no scar, and you can return to full normal activities right away. In fact, Doreen there went shopping later on that day. Now, you can learn more about medical stories on our website. It's located at WNBC.com. Again, that is WNBC.com. Now, after that big saphenous vein is lasered shut from the inside, then you can go back after the other varicose veins, like the ones around Doreen's calf, with sclerotherapy, that's injections, or with conventional lasers. Now, if you treated those before closing off the big one, those other varicose veins would likely come back, or you would just develop new ones.
So after you close the big one, then you don't have to go back?
Well, sometimes they might disappear on their own, but usually there's been so much disease and the valves have continued to fail that those things will stay there. But if you treated those ones around the calf first without treating the ones further north, then those things would come back. So you've got to go after the ones up north first, the big one, then go back in and inject the other ones that are smaller.
Aside from cosmetics, these can be painful, is that right?
They can, in fact, be painful. I mean, the women here describe them as sort of a throbbing in their legs, a painful kind of feeling most of the time. And obviously, if you spend a lot of time on your feet, then they're going to hurt even more.
Is this considered cosmetic surgery? In other words, would insurance cover this?
I think that depends a little bit on your insurance coverage, but generally, if they have become painful, then generally they would be covered by insurance.
Sometimes somebody just has a varicose vein or two. You know, it's not anything major, but cosmetically they want to clean up. Is it wise to go and have it taken care of?
Well, I mean, you can have it. That's mostly a cosmetic decision if it really hasn't started to get painful or interfere with your life. That's mostly a cosmetic decision. However, if you haven't gotten the full diagnostic to figure out where the problem is, like further up north, if you get rid of that one, it might come back. You can always try it.
All right, Dr. Max, I think we've covered this.
Everything we got.
All right, thanks, Max.
on The View. Tony Curtis. Plus, this summer, whether you're hitting the beach, setting sail, or leaving on a jet plane, don't pack your bags until we take all the hottest looks for any summer getaway out of the closet. Then, varicose and spider veins don't have to keep you covered up all season, because we're showing you a brand new cutting-edge way to make all those ugly veins disappear for good. All that and more next on The View.